All right. Well, hello everyone. I have 2 o'clock, and I know everyone participating here, like us at AMCHP, are probably scheduled on things like Zoom calls back to back to back all day long. So we'll go ahead and get started on time. It looks like we have about 100 folks signed in already, and I'm sure if you may join, but in the meantime, welcome to today's call. So far, I think these have been going well, and we really appreciate your participation. Um, Quick housekeeping, if you need anything, you can contact Jessica Cohen, jcohen@amchip.org. We do ask when you are asking questions in the chat box to make sure that you're sending it to all attendees and not just the panelists. This way everybody can see what questions are being asked. Of course, if you have a question that is specific just for the panelists, or like a technical support question during the webinar, please feel free to just send to the panelists. Our agenda today, Jonathan, do you want to kick us off?
Yes, thank you, Amy. And again, thank you all for joining us again for our third town hall. We got really good feedback from you on this forum, but also just general feedback, generally good feedback from you that we've been able to pass along to our agency partners so they can help share that along within their organizations, as well as it's helped to inform for us as AMCHP how we need to best support our members during this COVID-19 response. So thank you again for joining us. Thank you, Amy, for organizing this and getting us together, as well as Jess Cohen on the AMCHP team. Today we're going to have, since we've had some new legislative activity, we're going to have a very brief update from Amy Haddad at AMCHP on the CARES Act 3.5. And then we'll have an update from our partners at the CDC. We actually have a couple of new CDC team members to join us on the call today. We have had Dr. Gina Peacock and Romeo Galan in the past. This week we were joined by Doctors Carla DeSisto and Dr. Jennifer Nelson, who are from the MCH unit of the at-risk medical condition team within the Community Interventions and At-Risk Task Force, who will provide us with an update. We'll also have, again, Dr. Michael Warren, Associate Administrator of the Maternal and Child Health Bureau for HRSA. So we will have those updates taking place very shortly here. And then one of the things we want to make sure we have time carved out for is to hear from you. We really felt there was a rich discussion last time that, again, provided us with a lot of great insights. We want to make sure you have an opportunity to ask questions, but then share the things that are happening in your states and territories. So before I turn it over to Amy for her update, I also, again, want to thank you for joining, but also thank you for your response and your professionalism in responding to COVID-19. We know that you are sacrificing in many ways, personally and professionally, to make those that you serve safer. That is not lost on us. And if you have not had someone give you a thank you or a virtual high five today, I'd like to be the first one to do that and just say thank you for all you've done to make us safer during these uncertain times. My thoughts and prayers are with you on a daily basis, and I'm so proud to be a part of AMCHP and to be a part of this public health community for our response. Appreciative of all you're doing, and just impressed by the level of leadership that I've seen in this response. So kudos from me and on behalf of our AMCHP team. And with that, I'll turn it over to you, Amy.
Sure. Thanks so much, Jonathan. So just as a little bit of legislative history and what I think is the quickest amount of time we've ever seen Congress pass so many supplementals, there were 3 packages passed by the end of March. And then the package that they've called 3.5, which is the Paycheck Protection Program and Healthcare Enhancement Act, became law on April 24th. That link should be clickable. If not on the webinar, then certainly in the slides that were sent out. It's a good summary, but this was partly in response to the loan repayment or the loan program that got rolled out and seemed to dwindle from enough funds pretty quickly, but also recognizing that there were greater needs to support for healthcare providers and public health. So I'll focus on those pieces. There was the additional funding, like I said, for the hospital and healthcare providers, also a plan in place to increase testing, and then the small business loans. As part of the hospital and healthcare piece, it's $75 billion to provide reimbursements for care-related expenses or lost revenues attributable to COVID-19. We know that a lot of other elective procedures and other appointments that are being missed, et cetera, things that aren't happening right now are actually having an effect on providers' bottom lines. So in addition to the needs they need for addressing COVID, they have other business-related needs. And then $25 billion to increase testing for COVID-19, which includes $11 billion for states, localities, territories, and tribes. $1 billion for CDC for surveillance, epidemiology, contact tracing, and other activities. And one thing that's really important is that it requires that states that receive funding to submit a testing plan. So I'm not sure if folks on the phone will be part of how that gets rolled out in your state, but this is a requirement of receiving these funds. And then finally, there's also a requirement for HHS to report to Congress data that includes demographic data on positive diagnoses, hospitalizations, deaths. It's pretty well spelled out in the legislation what is required, and I know this is an interesting discussion that's ongoing about what information is actually being collected by the providers and submitted to the state, and how you're able to report that back, but also reporting on all of the demographic data that we know will be really important in order to understand the true effect of this pandemic, as well as probably, as we all know, highlighting a lot of the existing disparities that we've been aware of before, but that we know are even further exacerbated right now. And then again, for HHS to present a strategic testing plan to Congress. So that was passed most recently, and now Congress is moving on to working on the next phase of the package. Maybe we'll call it number 4, I don't know, but we've certainly been communicating some of our priorities from an MCH perspective, including more funding and support for Title V, for programs like CDC's surveillance for emerging threats to mothers and babies, for MCHB, and including pregnant and breastfeeding women in clinical trials and research around vaccine and treatment development. These are some of the issues that we've been really involved with, but we really appreciate the information that we're able to gather on these calls in order to communicate, decide what needs need to be conveyed and communicate those to the right people. And then lastly, I just want to mention something that I think is really important. I want to make sure everyone's aware of, and that's the Medicaid disenrollment freeze. And if you click on this picture, it's also a link to a good article about it. As of the Families First Coronavirus Response Act, states may not disenroll any Medicaid beneficiaries who were enrolled as of March 18th. And so this also actually extends to pregnant women, even in places where they would normally lose pregnancy-related Medicaid coverage after 60 days, they may stay on through the course of the emergency. So I just wanted to point that out because that's a really important benefit that we know, is crucial to our populations. So I will turn it over now to Dr. Warren.
And actually, before Dr. Warren jumps in, Meg Camo had questions in the chat box. Meg, we will during the Q&A period, we'll start addressing some of those questions. So we haven't, we're not overlooking you. We're just we'll bring those out during the Q&A period. And then also before Dr. Warren starts, I do want to thank our federal agency partners again, who have carved out time in their busy schedules to commit to this town hall. Our MCHB partners, Dr. Warren, and our many partners that we've had on our CDC side who've joined as well. So thank you to our MCHB and CDC team members who have consistently made the commitment to be a part of this. So with that, Dr. Warren.
Great, thank you, and good afternoon to you all. Appreciate the opportunity to join and be with you and share updates from MCHB. If we could advance to the next slide. Just as a reminder, we've set up a COVID web page where we're compiling frequently asked questions, information around temporary reassignment, and other general information for our grantees. And so you can reach that at mchb.persa.gov. That link is on the slide there, and also in the slides that will be shared with you as we move forward. Next slide, please. So this week, we also sent out information to home visitors, to MCHB grantees regarding different safeguards and harm reduction strategies for home visitors and families during this COVID-19 time. Really appreciate the consultation and collaboration with CDC on getting these out. We had some questions as before many states suspended in-person home visits, there were lots of questions about home visiting. And I think as states think about reopening various services, this will be a resource to folks. Next slide. Really excited also today to announce that HRSA awarded $15 million to 4 entities to support telehealth-related work in response to COVID in 4 buckets that you can see here. So pediatric care, that was awarded to the American Academy of Pediatrics. Maternal health care, that was awarded to the University of North Carolina at Chapel Hill. Family engagement, awarded to Family Voices. And then state public health systems, awarded to AMCHP. And this is funding that was made available through the CARES Act, one of the pieces of legislation that you just heard about from Amy. So excited to be able to announce that and really appreciate these 4 partners and the work that they will be doing over the course of the next year. And then next slide. So if you can see, I don't know how much you can see on the video, I'm wearing my Nashville Predators hockey jersey. One, because I'm mourning the loss that this is typically hockey playoff season, and that's where I would be. But also as a reminder that we need to ask ourselves this question, and we're in the middles of the COVID response and thinking about all the urgent things of the day, which we need to be thinking about. But I love this quote from Wayne Gretzky. Someone asked him one time, how did he get so good at hockey? And his response was, he skates to where the puck is going to be, not where it has been. So I just want to throw out that question, and I know we'll have time for some conversations later. I hope it prompts some thoughts within all of you. I want to ask, where is the puck going to be for MCH populations in 3 months, 6 months, a year, 3 years, 5 years? What is it that we need to be, in addition to the things we have to be thinking about and doing now as part of the immediate response, what do we need to be thinking about for the future so that we can start planning now, whether it's from a programmatic standpoint or whether it's a funding standpoint? And you all know those needs well. You can anticipate them. Your Title V needs assessments are likely very enlightening as you're thinking about this, as are your MCHB needs assessments. But we would love as a Bureau to continue to hear from you about where you think the puck is going to be, specifically with regards to children and families and the needs that may be coming up as a result of COVID. So please feel free to share those in chat. Feel free to email us at any point, reach out to me, reach out to your project officers. We would love to hear from you on that. And that's the last slide for me. Just want to thank you all again for your continued participation on this. And as Jonathan said, for the work that you're doing every single day, and in many cases around the clock on behalf of MCH populations. Thank you all.
Thank you, Dr. Warren, and thank you so much for, again, your commitment and your leadership in this space, and for the confidence in AMCHP to work alongside you in this COVID response. We really appreciate that, and look to support our members in that way. Turning now to, and we will, I would just double down on something Dr. Warren said. The question that he posed about what we're seeing in the MC, what you all are seeing in the MCH populations that you're serving and the needs that are there. That will be one of the questions that we'll have conversation around after our presentation. So please start thinking about that, or as Dr. Warren mentioned, please add comments into the chat box as you think of them. With that, I'd like to introduce our CDC partners. We have Dr. Carla DeSisto and Dr. Jennifer Nelson. Thank you so much for joining us today to share out your CDC updates.
Hi, everyone. I'm Carla DeSisto. Thanks so much for the opportunity to participate in this call. I'm very excited to be here and to be able to provide you some updates around the MCH related work underway in the Community Interventions and At-Risk Task Force at CDC. And I apologize that we don't have any slides for you today, but I just wanted to spend a few. Can everyone hear me okay?
I can now.
Okay, I'll try to speak closer to my microphone. So I just wanted to spend the next few minutes briefly discussing updates to some of our CDC guidance and messaging, as well as new information we're developing. My colleague Anne will share the links that I'm referencing in the chat box as we go. So to start off, 2 weeks ago, Georgina mentioned that our breastfeeding guidance was being updated. So that has actually been finalized now and is on our website. So this guidance is primarily aimed at healthcare professionals who care for breastfeeding women and infants who receive breast milk in the context of COVID-19. Some of the updates include information for breastfeeding mothers who work in settings with higher risk of potential exposure to the virus, such as healthcare personnel and first responders, who may have additional concerns related to expressing breast milk while at work. Clarification that an infant who is breastfed by a mother with confirmed COVID-19 should be considered as having suspected COVID-19 for the purposes of infection control and prevention for the duration of the mother's recommended period of home isolation and 14 days thereafter. And considerations for using alternative approaches such as telemedicine when providing lactation support services to breastfeeding dyads. Georgina also mentioned 2 weeks ago that we were beginning to develop information specific to children and youth with special healthcare needs based on feedback we've received. We have finalized our frequently asked questions related to children and youth with special healthcare needs. These FAQs are primarily aimed at parents and caregivers. Some of the highlights include additional steps families that have a child with an underlying medical condition or special health care need can take, such as identifying potential alternative caregivers in case the regular caregiver becomes sick and unable to care for the child, and having at least 1 month of medication and medical supplies on hand. Advice about helping children adjust to new routines and follow public health recommendations, and a reminder not to delay getting emergency care because of fear of getting exposed to COVID-19. On a related note, we're also in the process of developing guidance for group homes and residential treatment facilities. While these are not specific to children, there will be some overlapping themes that may be of interest. We'll share more about this when the guidance has been further developed. We also recently updated our webpage on pregnancy, breastfeeding, and caring for young children. It hasn't been posted to the web just yet, but it will be very soon. Some of the updates to this webpage include language that explicitly states that face shields for newborns and infants are not recommended after we received reports of some hospitals using face shields on newborns. A reminder that well child visits and routine vaccine visits for children, especially children less than 2 years of age, are still recommended during COVID-19. A summary of SIDS prevention guidance due to concerns that parents' increased stress and fatigue may affect their infant sleep practices, and more information about coping with stress and depression, including postpartum depression. Finally, I wanted to mention that our team is working on developing some social media content about the importance of well child checks and vaccine visits, as well as issues related to postpartum depression and COVID-19. We'll share more information when those are ready. I believe that's all we have for today, but my colleagues and I are happy to try to answer any questions you have when we're ready for that. Thank you.
Thank you so much, Dr. DeSisto. That's very, very helpful and exciting that the guidance that the guidance that's being released is in direct response to some of the feedback that was received through these calls. So thank you for your team's responsiveness to what Dr. Peacock and the team heard over the last couple of calls. At this point in the call, I'd like to just open it up for comments, questions, and sharing, and we'll keep a similar format that we did in the past, where folks who have questions, please type them into the chat box, can unmute themselves and ask questions directly, and we'll have some discussion prompts that will lead our conversation. But if you feel like there's just something, a burning question that hasn't been touched on, please feel free to do that. Meg had a comment that a question that came in early, so I'll make sure we get to that as well. And let's start with that actually, Meg. So your question was for Amy, and it said, would you say more about the intersection between Health and Human Services strategic testing plan and the state's testing plans?
Yeah, no problem. So the HHS is tasked with providing to Congress a strategic testing plan that includes what kind of assistance it's providing to states, localities, territories, tribes, as well as an estimate of testing production, guidelines for testing, a plan to increase domestic testing capacity, a plan to address disparities in testing, and outline federal resources available to support the testing plans of each state. And each state is supposed to report back a plan for the number of tests that they estimate will be needed, like on a monthly basis for the rest of the calendar year, what their estimates are of laboratory and testing capacity, and a description of how they will use the funds that they receive. So they are obviously linked to one another, but they are specific to each entity and what they're being asked to report out on.
Thank you, Amy. Meg, please, thank you. She said in the email that's in the chat box, so that's very helpful. There was also a question from Sarah, and I believe this is for you, Dr. Warren. Going back to the announcement about the telehealth funding to Family Voices, is it known yet whether that funding will stay with Family Voices National, or will some of it go to state FTF organizations?
Thank you for that question. So the awards were just made today, and the award for that particular portion of the funding is going to Family Voices. And I'll read you the description from the media release, which I'll also put the link to in the chat box. But this particular portion of funding is to expand telehealth services for families of children with special healthcare needs through trainings for families and national family organizations on accessing telehealth, including for routine care and services they're not accustomed to accessing virtually. So the plans for that are evolving. Again, those awards were just made today. So we'll look forward to continuing to work with our partners at Family Voices for that particular award on their plans for that. And like I said, I will put the link in the chat box right now so you can read the full release.
Thank you, Dr. Warren. We've got a question from Karen Downs. I believe this is for the CDC team, Dr. DeSisto and Dr. Nelson. Is there a recommended age at which children should wear a mask? For example, in my community, anyone 3 and older must wear them. Parents would be fined. But are there situations that you would or would not recommend beyond newborns?
Yeah, thank you for that clarifying question. So CDC is recommending that cloth face coverings should not be placed on children under the age of 2, anyone who has trouble breathing, and then anyone who's unable to remove their face mask by themselves. So if they're unconscious, incapacitated, or otherwise unable to remove the mask without assistance.
Thank you. Another question here from Jenny. Thank you so much for the update and the guidance on breastfeeding and children and youth with special healthcare needs. We'll share with our DOCD, DOH for consideration in the medical environment. Okay, that's just a comment there. Thank you. Question from Joyce Marshall. Carla, can you say more in relation to the new recommendation for children under 2 years of age?
Sure. I'm not sure if that question is related to cloth face coverings or to the actual face masks. So CDC has been saying that cloth face coverings should not be placed on children under the age of 2. We also had recently received some information from the media that face masks were being placed on some infants. And so we, on the new webpage, which I hope will go live very, very soon, we've clarified that face shields in particular should not be placed on infants.
Thank you so much, Carla. We've got a couple of comments, a comment and a question from Ben. One of the comments is the barriers we've seen to both telehealth and education for kids regards limitations in data packages and bandwidth. So that's a comment. And then a question from Ben. Is there anything being done to ensure equity and access to cell service and adequate bandwidth and data to support virtual healthcare and education? I don't know if anyone wants to respond to that. I know part of the conversation that we're having and wanting to have as part of the funding that is again is early stages that we've received is doing an environmental scan to get a determination on some of those challenges, just to see what capacity exists in communities where that is a challenge and how we might support the state and territory response to that. So that's still to be determined, but it is part of the environmental scan and initial analysis from our perspective. Amy, did you have a question or a comment on that?
I was just going to add, coincidentally, right before this call started, I saw a press release from Energy and Commerce Committee saying that there is actually a rural broadband task force that has announced today a plan to connect all Americans to affordable broadband internet. And it specifically cites how we must, the urgency to accomplish this is because of the COVID-19 pandemic. It just highlights the iniquities that it's causing. So there's an effort to both highlight this and ensure that this plan hopefully will be either funded or enacted through the next COVID response legislation.
And Rebecca comment, I think it was related to Ben's comment, but there's a comment that the FCC may have a funding opportunity for infrastructure to support telehealth as well. Dr. Warner?
Thanks, Jonathan. I would also add a couple of things. One, remember one of the most flexible tools you have as states is your Title V block grant in terms of flexibility for the MCH population. Clearly, you don't have enough money to build broadband infrastructure to serve everybody in your state, but there may be ways that you can use your block grant funds to meet related needs for your population. So I think if that comes up and that's of interest, we're always happy to entertain those questions. Please reach out to your project officer. Similarly, I know we've been able to provide some information to MCHB grantees as they've had families who have had difficulty accessing services because of issues with broadband access or data plans or things like that. So again, if those kinds of questions are coming up in your programs, please feel free to reach out to your project officers, whether that's MCHB or Title V, and we can think about what flexibilities you might have there.
Thank you so much. What I'd like to do, these are great questions, but I also want to allow some time here to hear from you. And we have a couple of questions that we have sort of circulated before this call, but I'd like to go back to Dr. Warren's last slide, second to last slide, to start the conversation. What can we anticipate now for future MCH populations, for MCH populations in the future? And I'd like to just either in the chat box or open up the line to get your thoughts on that, what you're seeing. So I see a comment in the chat box from Dawn, a comment for future thoughts. As a family navigating the many systems adjusting for the COVID-19 response, we experienced a lot of disconnect between our services, even as guidance was being released. For example, it took 2 weeks from when our state Medicaid authorized telehealth for therapies for the agency responsible to roll out to vendors and providers. Once rolled out, the state OT licensing board said teletherapy was not allowed and it required an executive order from our governor to get authorized. All this to say, I think we need to work across various sectors of services for our populations to ensure if we have to face this again, everyone is ready to enact and not delay for those they serve. I imagine this may be happening in various settings. Thank you so much for the comment, Dawn. That's exactly the type of feedback I believe we're looking for. Jess also wanted me to, one of the AMCHP team members wanted me to know that everybody in this format is able to unmute themselves with *6 on your phone. So please feel free to do that as well. Any other comments around what we can anticipate now for MCH populations in the future? We can hear you vaguely. Okay, so a couple comments coming through in the chat box. What about healthcare providers who are pregnant? Should they be caring for COVID patients? And then with Karen Downs' comments, within our home visiting programs, it is clear that moving forward, we will need to incorporate a hybrid of in-person and telehealth. Also, obviously, this crisis has shown a light on inequities in access to health. A couple more comments coming in. Actually, a decent number coming through now. From Amy, Mullinex broadband, many school systems around the country are also attempting to support access for their students. Telehealth and school infrastructure efforts are of joint interest to MCH populations, a chance to break down our traditional MCH silos. So thank you for that regarding the telehealth conversation. It looks like from Rebecca, this is maybe.
I unmuted if that would be easier.
Yes, please.
So I was, another comment about telehealth. One thing we've been talking about in Louisiana is that it's really helpful to have telehealth available, and the fact that we've worked with our Medicaid to make sure it's covered and that we can get revenue while we're doing our telehealth visits. But when it comes to children and youth with special health care needs, that could improve our access in the future after this crisis is over. We also want to make sure that we balance that with what is telehealth right now just to get by, and what telehealth, we don't want to just say, hey, telehealth worked, let's keep it forever in every circumstance. We want to make sure that we're thinking through, like, where would it be good to keep it, and where should we consider potentially phasing it out or having it available in emergency situations only, because I do think that it increases access to services, especially ones that don't require hands-on.
Yeah, no, that's a great comment. So I would think about sort of learning from the current to figure out what we need for the future of our infrastructure is how I think about that. That's a great comment.
Hi, this is Wanda Barfield from CDC. I wanted to thank everyone for the great presentations and the participation from the panel. And I think Rebecca's point is well taken about telehealth. I think we need to better understand and characterize what telehealth contains, because there will be some things that might be easily done within that structure, but then other things that really need more face-to-face time and/or observation. In terms of other emerging MCH issues, I think it's really important for us to also understand the role that stress might play. For example, how might that impact some health outcomes like preterm birth or other areas that we really need to continue to monitor and understand.
Thank you so much, Dr. Barfield. There are a few more comments coming through here, but again, for anyone who wants to offer their comments, please, you can unmute as well. Let me go back here. This is more of a comment. Thinking of our new normal, developing a richer product for telehealth was a comment that came through from Jensine. In terms of future issues, Blair commented that can foresee the need of more attention to food insecurity, and the ramifications. I'll add on to that, the ramifications of that going forward. Joyce Marshall, collecting data in relation to COVID-19, positive pregnant women and pregnancy, birth outcomes to inform best practices. So what I read into that, Joyce, if you want to unmute, is just a need now to make sure we're collecting appropriate data to understand what we're dealing with currently, but what some of these long-term impacts may be. And if I mischaracterize that, please let me know.
No, that's correct. We're trying to work to start gathering that data so that we'll have it to inform best practices for the future.
Great, thank you. I think Ben has raised his hand to talk.
Jonathan, this is Jennifer Nelson.
Please go ahead, Jennifer.
I wanted to go back and answer the question about the pregnant healthcare providers. And this is actually one of the questions that we've gotten quite a bit. And so it's in the web updates that Carla mentioned. Our guidance is going to, our recommendations are that the pregnant healthcare workers should discuss their concerns, obviously, with their employer, and then follow any risk assessment and infection control guidelines for other healthcare workers that may be caring for COVID positive patients. And then, the other thing is that a pregnant healthcare worker, in talking with their employer in the context of their local situation and so forth, and to see if they could limit or if they could change positions and roles, to especially if they are responsible for higher risk procedures such as aerosol generating procedures and so forth. So that information will hopefully be posted to our website sooner rather than later.
Thank you so much.
Jonathan, this is Ben Hoffman from Oregon. So I just wanted to make a comment about telehealth as well. I'm sorry to go back to that, but we're, as a clinician for the last 5 weeks, I've done nothing but virtual visits via our electronic medical record on Epic. And it's my fear, it's great for some things, for families that I really know well, and when I don't require physical exam, I see how there could be lasting benefit to it. I worry a little bit that we'll be pushed to do more of them because of efficiencies, and there's a potential for payers to push those and then pay at a lower rate. And I think if there's not advocacy to ensure that utilization of those resources are based on mutual decisions between the provider and the family, that especially for kids with special health needs, we could get trapped in a corner that we're not going to be happy with. Because as I said, sometimes some of the visits have been great, and sometimes they're not. And as a provider, I know which families it'll work for and which families it won't work for.
Great comment, and I think that's along the similar lines of Dr. Barfield's as well, and others. So I think that's a great comment, great examples. Thank you. I'm going to try to read through a few of these comments here. A couple that may need clarification, but I'll go through the comments that are coming because we're getting great feedback on some of the anticipated needs and some discussion around the telehealth piece. Tammy McKenna, we have seen, at least in the orthodontia world, that telehealth cannot replace an adjustment. So going, I think underscoring that it's great for some circumstances, but not the end all be all. So be mindful of that. Blair, in our very in one of our very rural counties without a grocery store, the public health nurse is going grocery shopping on Sunday and delivering food to porches on Monday morning. So that may be in response to the food insecurity piece, or also just what the new normal now is in terms of supporting some of the food insecure members of our community. So I believe that's the spirit of that comment, Blair. But if I've mischaracterized that, please unmute and let me know. Yvonne, pediatricians being able to have more flexibility to decide if the number of their office/well child visits should be lessened or maintained to allow for accessibility. Sounds like just a suggestion or comment. Did you want to say more about that, Yvonne? Okay. Jenny, lots of lessons learned from this pandemic. Many guidance has been put forth. That's very disease-oriented and responding to downstream. I think we always have to work upstream. I think that would probably resonate well with Dr. Warren and his team in terms of the accelerate upstream together points that he has been championing. Ileana, I wanted to offer, looks like what some of the anticipated the challenges with MCH populations going forward. From the adolescent and young adult perspective, from those populations, several MCH programs are highlighting unmet needs and access to services that have been amplified because of the COVID-19 pandemic. For example, not being able to access reproductive health or sexual health services, mental health visits, or even well visits in general may have been tabled for the time being. Yvonne also highlights here support for early Head Start programs to give more support for more mental health programs. We're getting a lot of good feedback in here. While availability of respite and skilled nursing support for families with a child with special healthcare needs has been an issue prior to COVID, the social isolation tied to the stay-at-home orders and the anticipated continued isolation during an extended return to a new normal is shining a greater light on this need for families. Parents need additional and different types of supports. A common access and quality related to telehealth, especially for children with special healthcare needs, feels like a very important research topic. Here's a question, and I'm not sure who it's geared towards, but it may be for the CDC team. Any guidance around hearing and vision screening?
This is Carla. I saw further down that she clarified it was hearing and vision of school-age children.
Yeah, I see that.
I haven't seen any guidance related to that, but I would defer to my other CDC colleagues on the line if anyone has seen such guidance.
This is Jennifer Nelson. No, I'm not aware of guidance for school-age children, but that's definitely something that we can talk about adding and so forth, especially you know, since schools are out, and then, you know, who knows what's going to happen with the next school year, but that's definitely something that we need to keep on our radar.
Great, thank you. Karen in Massachusetts is highlighting a concern here. A current concern is the high stress that women giving birth are experiencing, with limits on who can support them in labor. Hopefully this will ease, but for women delivering during this time, the ongoing stress from the trauma may affect their parenting. Also agree with Wanda Barfield about the impact of stress on pregnancy and early parenting. Okay, Dr. Warren agreeing on the upstream. This clarification. Dorothy Salenti in UNC. Does anyone know if WIC food packages had transitioned to virtual remote ordering and delivery? I'm just curious about the food insecurity issue. Does anyone know about that?
Yeah, this is Ben Hoffman in Oregon. There are definitely county-based WIC providers that are doing that, that are doing online and phone services and then delivery.
And
this is Tammy in South Carolina. We are doing a lot with our WIC population, and we have done, like, we've done virtual, we've done almost everything we can think of to ensure that the families are getting those WIC, you know, the WIC supplies that they need. So we've been pretty creative. It's all over our DHEC website if anyone wants to take a look.
thank you. I'm also seeing here in the chat box that in Massachusetts, WIC is being provided virtually. Hawaii has rolled to eWIC and distance issuing as well. So a few examples there for you, Dorothy. I'm going to get through these last couple of comments quickly so we can move to one of the other prompts. I think this has been really good discussion. I don't want to cut it off. So if you have any other thoughts or suggestions around anticipated needs for the MCH population in the future, please continue to add them into the chat box. Kate Johnson with Charlie Bruner and Ink Marks. We will be hosting listening sessions with pediatric practitioners in the next 2 weeks, aiming to learn what they are doing now that may work in the future. Also to learn about their current challenges, and we'll share the results with us the third week of May. State MCH agencies can encourage Medicaid to pay equivalent rates for MCH services delivered via telehealth and to pay promptly. So thank you for that note, Kay. Looks like Laura offered comments around the screening mandates. States have mandates to screen, and we are looking for ways to plan. Sarah wanted to offer another comment around future needs for the adolescent and young adult population. The short and long-term impacts on mental health and well-being related to having some of the typically really important events being canceled, for example, prom, graduation, etc. For some, it might seem trivial, but this is really impacting some young adults out there. Thank you for that, Sarah. I have a couple, my son and a couple of other family members who are feeling that pain. So it is not trivial at all. So I completely appreciate that. Is there? I heard someone taking themselves off of mute, and I think I was speaking. But did you want to chime in? Okay. Down to the end here from Edie. Will the new testing identify those who are asymptomatic, and how can that be combated with telehealth? I believe, Edie, is that for the CDC team? Yes, so that's the question for the CDC team. Will the new testing identify those who are asymptomatic, and how can that be combated with telehealth?
That is outside of our wheelhouse, and we'll definitely can get back to you on that.
Great, thank you so much, Dr. Nelson. So with that, Amy or Jess, would you mind advancing the slides so we may have time for one of our additional questions here. I'm sorry, I'm getting a note here. Karen Downs and Jonathan Borden have had their hands up. Karen, did you want to make a comment?
No, that's okay.
Thank you. And Jonathan Borden?
Yes, I'm not sure if this is upstream or downstream or what, but I have a concern about in the future. Right now, we're looking at a situation where we had an estimate of 1.5 to 2.5 million deaths, and that number has been out there. Now, with social distancing, it was like 100 to 250 or something like that. Things seem to be going better, and if we continue where we have these aggressive reopenings and hopefully everything goes really well, I'm a little bit concerned that down the line, we're going to have a situation kind of like we have with hurricanes, where there's a hurricane, there's a big warning, it hits, it doesn't really amount to anything, and then eventually you get in a situation where you have more and more people who are saying that they're going to try and ride it out. And while it's a great thing that things are going better than we expected, I think down the stream, we have some concerns around messaging. Like, I would really like to see at some point us trying to figure out a messaging for our population, especially when we're working with children and youth with special health care needs and their families and some social economic issues, to kind of cut through what I think is going to be a very loud voice saying, oh, well, you said it was going to be horrible, and then it ended up not being that bad.
Great comment, Jonathan. You've got a couple of folks in the chat box who are strongly supporting your comment about messaging. And any others, because I think we're actually transitioning into that portion of our conversation where we're talking about some of the considerations and anticipated impacts of reopening or easing restrictions. So any additional thoughts? Thanks for getting us kicked off, Jonathan. Lonnie has a comment here. I believe this is around the MCH populations, but we'll need to understand whether there are long-term health consequences for populations, including MCH populations, for those that became sick with COVID and now have recovered. Will we see ongoing health needs that will need to be addressed? Thank you, Lonnie. Any other comments along the population line or along the lines of considerations and anticipated impacts of reopening?
Hi, this is Noelle Taxon, Jonathan from Utah. Well, I don't know if the silent, I was like, this question is a big issue on my mind because they're starting to loosen in Utah. And I think with the person who spoke about the messaging, people are saying, this was just all a farce. It was overreaction. We're fine. And people aren't wearing masks. And you kind of got two sets of people. People who are very concerned, people who aren't. And my concern is loosening too quickly. If all of a sudden our population gets very sick, it'll be like, oh, hindsight, oh, we should have been more concerned. So I am very concerned about the messaging going out that in Utah, at least, they're more worried about older people than anybody young and or CSHCN.
Yeah, I think that's I'll let other folks kind of weigh in, but I think that's a big concern that weighs on all of our hearts and minds, especially in the public health community, that a lot of the success we've been able to have has been largely due to the adherence to the restrictions and guidelines, and if that's not happening anymore, what are the potential implications of that? I think Meg is characterizing it nicely. When public health works well, nothing happens. Perennial messaging challenge. Anyone else on that? Did you want to move us to, we may have time for a couple minutes or a couple of comments on the next discussion topic, Amy. I guess this was just a time for state sharing. But are there any other needs or comments that folks want to offer? We are have had heard some comments around the acknowledging of the economic impact of COVID for the Title V block grant, including anticipated effects on budget moving forward. And we've heard some conversations around contact tracing and some discussions I've been in recently around building responses, building our response on making sure we're building our response on existing infrastructures. There's a lot of conversation that's happening now, and just would want to hear from the states in general. Any comments, concerns, questions, issues you're seeing that we have in the last couple minutes here together? Okay, if not, I'm trying to allow some time for things to come up in the chat box. If not, just a couple of very quick announcements. So one, our next town hall will be Thursday, May 14th, 2 to 3 Eastern, same bat time, same bat channel for those Batman fans. Again, want to thank our federal agency partners for making a commitment to this call and for joining and hearing the feedback, the comments, the concerns, and taking it into consideration, as you heard, with the responses that Dr. Warren is consistently offering from the Bureau, and the guidance that is consistently offered from our friends at the CDC. So thank you again for your time to the CDC and MCHB partners. Thank you as attendees who have carved out time in your day to receive this information. I did want to do a very quick plug that one of the things that our MCH directors and SHIN directors should have received in their inboxes on Tuesday was an email from Cheryl Clark, who is an AMCHP employee. And this survey was to gauge what your telehealth and, telework structure has been, and the impacts to your capacity has been related to COVID-19. We've got about a third of the response back to the survey, which is great for only been out for a couple of days. We love to have as many of you as possible. That survey is open until next Friday. So please take a look in your inbox for a note from Cheryl Clark and help us out by responding to that survey. So it gives us a baseline of understanding where you are and how we might be able to support you going forward. Thank you again for all you're doing. Thank you for your comments. Thank you for being engaged. And we are always impressed with your leadership and how you're supporting so many. So until next time, be safe. Thank you all.
Thank you.